Good evening, everyone, and welcome to another episode of Ask the Expert Live. This is your monthly 30-minute program geared totally towards answering all your questions. So this is for questions from persons with lupus, their family members, and anyone of interest. We're happy to be back with you today. And we are, of course, touching on a very topical subject, one that there have been lots of questions on, and we've seen it. We've received your questions, and we're going to be tackling them today. So welcome and stay tuned. You can pick up the stream, or your friends, if you wish to invite them, can pick this up on our YouTube page. That's type in Lupus Foundation Jamaica, and same thing for our Facebook page. We're being live streamed on both platforms. So my name is Desiree Tuller-Reed. I am a rheumatologist, and I'm your host today. And we have a special guest with us, and I'd like to introduce her. She's Dr. Lori Ann Fisher. I'm not sure she needs an introduction for everyone. And for many of you who are part of Lupus Foundation, you know her well. She's been volunteering with Lupus Foundation since 2018. And Dr. Fisher is a consultant internist, intensivist, and nephrologist. So here are three different places where, she interacts with and is very qualified to speak to us and share with us on the subject and answer your questions. So she is a consultant at the University Hospital of the West Indies, and she's our expert today. Welcome, Dr. Fisher.
Hi, thank you guys for allowing me to participate in a very topical discussion. Now we're in the middle of our third COVID surge. We're seeing a lot of hospitalizations for COVID. And I'm sure there are lots of questions for our patients living with lupus about how they can combat COVID-19 infection and the influence of COVID-19 on our current healthcare resources. So I'm really honored and happy to be a part of this discussion.
Yes, and we're so glad we could join us, because this is such a busy time for everyone, especially persons who do what you do. So you've been on the front lines of the COVID-19 epidemic in a number of ways. You're also a doctor of lupus patients. And to explain to our audience, what is an internist, an internal medicine specialist?
Okay, so an internist is a doctor that manages many systemic disorders. So, ranging from things like lupus, hypertension, diabetes, kidney disease, HIV, chronic medical illnesses, and that's outpatient management. Other inpatient management is just management of patients with acute medical disorders. So, severe diabetes, diabetic ketoacidosis, pneumonias or infections of the lung, or general infections, of which COVID is a type, and liver, kidney, heart disease as well, lung disease, and many other systemic disorders.
Yes, that's a lot of areas. So internists play a key role in this specialty, plays a key role in keeping many of us with chronic conditions out of hospital. Mm-hmm. And then they're also the doctors that we call upon to treat people who are in hospital. So if you're in hospital for anything other than surgery, chances are an internal medicine specialist is a doctor that's going to look after you. And you are even beyond internal medicine. you are a specialist in critical care medicine.
Right.
So tell us what's been going on for you. What's been your experience in the hospital? Give us the latest from the front lines of this epidemic.
So, I mean, this current surge is more severe than the last one. So we had a surge earlier this year, like about February, March of this year. But at least since the end of July, we've seen a significant uptick in hospitalizations. You need to bear in mind that our country, as a middle-income country, has a very low ICU capacity per population. So, or we have very little ICU space. And unfortunately, the way how COVID-19 infects the body is that it causes low oxygen levels because it infects primarily the lungs. And so what happens is that we have a lot of patients, because we have very limited ICU space, we have a lot of patients who are being managed on the ward that, you know, should really be in an intensive care unit. And the way how COVID infects the lungs is that it causes both a poor blood flow to the lungs and also causes the lungs to be very inflamed. And so it can cause significant drops in oxygen levels. Additionally, a COVID infection affects all organs. It has a capacity of affecting the brain, the kidney, the heart, the gastrointestinal system. So patients can be very, very sick. In this pandemic, we've had many obstacles. One is that we've had a lot of people who have come requiring very high amounts of oxygen, and some people have required oxygen that we need to push into their lungs, either through an endotracheal tube or a tube that goes into the lungs directly, or through a face mask. So yes, I mean, we've been very exhausted in the front lines on all aspects of care. Because we've had very, very sick patients come in. I must say that the difference in this COVID surge is that patients are younger. So I'm seeing patients in their 30s, in their 40s, in their 50s, as opposed to the prior surge where we saw older patients. And so, you know, the concern that I have is that you have these young, otherwise healthy people with severe or very, very significant disease, and often, you know, they end up dying, right? Because even though we do supportive care, really and truly, if we can't get enough oxygen to your body, you know, regardless of what we do, you know, you can end up dying.
Wow. Okay. So this is, that's pretty frightening. I know I spoke to you one day and you're on the way in the night to the hospital. There are 100 patients there with COVID.
Yeah.
So that's pretty scary, and it's in one hospital, so be to round on. So this is an important time to want to stay out of the hospital if you can. Mm-hmm. So we're here to address some really important questions. I know you're a doctor of lupus patients as well, because you look after their kidneys, and the kidneys are such a common issue in terms of lupus. And so you're probably getting a lot of the questions that I am getting. And we actually had 20 odd questions come in on this topic last week. And so we want to get right into it if we can. And just before we get into some of these questions, just want to remind you that Lupus Foundation of Jamaica is a member-based organization. So you can become a member, anyone can, but especially if you live with lupus, considering being part of this organization so you can get the support and information that you need to manage well, to do well, to survive and to thrive with lupus. So we invite you to visit our website, lupusfoundationjamaica.org. That's lupusfoundationjamaica.org, and just sign up. It's really easy with your email address, or give us a call. So you'll get more information at the end. So let's get into some of the, the topical issues. And, you've had a lot of experience with managing this disease, and let's just go right into one of the big things that's going around right now. So, one of our questions is, since the integrity of the medical professionals are in question. How does one know all flu-like and influenza-type symptoms are not being categorized as COVID? That's a big one.
That's a big one.
Yeah.
So, so a couple of things to answer that question. So, oftentimes we've been doing testing for COVID infection. So just to understand what COVID is, as opposed to other respiratory infections. So COVID is caused by coronavirus, and it's actually a specific variation of the coronavirus, which has been around for years. We do testing for coronavirus, right? So usually involves either doing a swab or taking a sample from the nose and the mouth, which tests for it specifically, right? As opposed to influenza, which is a different type of virus, which looks completely different. The second thing is that coronavirus infects us differently than the flu, right? So the flu tends to cause specific types of symptoms, usually, cough, rhinorrhea, etc. But the anosmia and stuff doesn't really happen with the flu, and the degree of respiratory failure with the flu occurs less with coronavirus. Occurs more with coronavirus, I'm sorry. And secondly, coronavirus is way more fatal than the flu. So you're talking about, even though we say it's like 1 to 2% of a case fatality ratio, if you think about that, every 100 person who gets coronavirus two of them will die. That's actually really high if you think about it, because it's very contagious. So if you're looking at, if 2 million Jamaicans get COVID, you're looking at a significant amount of them dying, 2 of 100 of them dying, and maybe even higher than that. In some reports, it's up to 5%. That's a really high rate when you compare that to the influenza. Influenza is 0.03. That's really, really low compared to coronavirus. So the second thing is that the flu tends to be seasonal, meaning that you have peaks and troughs of the flu, whereas coronavirus tends to have surges, especially correlating with reopening, more social, because it's a very contagious virus. It's way more contagious than influenza. So, the way how we know is that, one, usually we have, in terms of, you're having way more deaths than influenza surges. Even with H1N1, this is even higher than that, right? And the second thing is that there's no seasonal basis for this. It just happens when we've opened back up and there's more communication. This thing is way more contagious.
Right. Wow. So yes, you actually answered, or just about answered, a related question that I grouped, which was this is a distinct feature that is looked for to determine one has COVID as opposed to bad flu and influenza. So that's a related question.
The big thing is testing, right? So, influenza we can test for, and flu we can test for. So, we've been testing these people and we're finding evidence of what we call the COVID PCR, which is essentially the DNA of the virus, right? So, although it's an RNA virus, but the actual testing for the COVID itself, the actual coronavirus itself, we can actually test for influenza itself. And a lot of these people are COVID positive, but influenza negative.
Yes.
And so, we know that for sure. And certainly the influenza, once you've gotten sick with influenza, you actually recover and get better. Or, if it worse come to worse, you're one of that 0.03% that dies. However, what we're seeing with COVID is long-term effects of COVID, not just, related to the lung itself, but fatigue, mental fog, and even kidney disease linked to COVID disease, which we don't get with influenza.
And chronic lung disease. Yes. Neurological. So thank you for answering those questions, because one of the, I guess the big answer is that it's best to have a test, but I think we also take into account like what's going around. That's one of the things that doctors take into account when we actually make a diagnosis of something. So if there is a dengue outbreak, then, you kind of put the context is important. And we know that COVID can, go bad in an unexpected way, unpredictably sometimes. So is there, you mentioned anosmia, so one of the things that people are asking about this new surge and the Delta strain, what do we need to know about that? Is that presenting itself differently? Is there still a good way to recognize, that you may have it, or is it less easy to distinguish because we're not seeing that some of these classical symptoms that we were given as a description for before?
Right. So remember that even though anosmia is pretty it's kind of pretty specific for COVID infection, remember that not everyone will have anosmia. And two, anosmia may be difficult to pick up because, is it that you're having some stuffy nose and therefore you can't smell, which can happen with
right
flu.
We should have explained that that's when you can't smell.
Yeah. And so, it's kind of difficult symptom. I would say that even the high positivity rate in our country, if I were a betting person and you had a flu-like symptom, you're most likely going to have coronavirus. One, because we are in a surge. So
it's a high prevalence.
A high prevalence.
What was the rate? 48% of the positive.
So it's a high prevalence
of the tests.
And so COVID. If you're going to guess most likely that you would have coronavirus, right? Because we're in the middle of a surge. And remember, this thing is way more contagious than influenza. So, it's more likely that you would have coronavirus than influenza.
Are people also getting a little unusual symptoms, such as nausea, vomiting, that kind of thing? Are you seeing people presenting with other kinds of symptoms that are not really typical of respiratory tract?
What I'm seeing now is a bit more gastrointestinal symptoms, so diarrhea. You can get something called like a COVID enteritis, but certainly most common symptoms are going to be symptoms of respiratory phenomena.
Upper
respiratory symptoms like cough, runny nose, stuffy nose. A lot of people tell them like they feel like they have sinusitis, so their sinuses are that kind of feeling. And fatigue is a very common symptom. So you're not feeling yourself, you're feeling tired. Fever is very common.
Right. Okay, so here's a question. What do the experts know? I'm interested in finding out what the experts know about the efficacy of the COVID-19 vaccines in persons with compromised immune systems, such as lupus patients.
That's a really good question. So, it depends on the patient's medications. So, in patients with lupus, oftentimes they're on immunosuppressive medication. So, in order to control the inflammation, we suppress the immune system. However, your immune system is important in recognizing foreign objects. And this is why the vaccine is in, and this is why you got an impaired response to the vaccine, right? So because of some of these medications, primarily, especially patients on Cellcept or MMF or methotrexate, there is a lot of patients, there's a lot of data on transplant patients, the patients who have gotten, for example, kidney transplants who are on Cellcept, which is commonly prescribed in patients with lupus, that their response to the vaccine is not as good, right? So in order for us to build immunity, we have to get antibodies, and antibody response may not be as good in lupus patients because they may be
So we're mindful that certainly in the lupus literature, we're seeing that lupus patients do and rheumatic disease patients do respond to vaccines, but just from what you're saying, we find that those who are on more immunosuppressive medications may not have as strong a response. That'd be right to say. So it may not be a stronger response, but there is a response most of the time. So it's worth doing it because you do get a vaccine response. So there's that issue of effectiveness. And another question is about vaccine safety. I have one question about allergies. If you have allergies and the person doesn't specify, does that prevent taking the vaccine? So that's a general question about the vaccine.
So no, it doesn't. So most the unless you're allergic to a specific component of the vaccine, but no, it doesn't. And remember, these vaccines don't have eggs, so egg allergies are fine. So most people with normal allergies, no, there's no contraindication.
So most people with sinus problems, hay fever, milk allergies, peanut allergies,
So those are not
egg allergies, those don't count, right?
They're not components of
because they're not part of the vaccines, and none of the vaccines are on the market. So that's good to know. Here's the question. So is the big question, is a vaccine safe for persons with lupus?
I would say that the benefits of vaccination in patients with lupus, or patients in general, especially patients in lupus, outweighs the risk. So the side effects of the vaccination reported are rare. The problem with getting the actual coronavirus, your likelihood of getting it in this present surge is high, and vaccination has been the only thing so far that has been proven to prevent getting COVID. If you actually do get COVID, you're less likely to get severe COVID that ends up in death or hospitalization. So vaccination, regardless of efficacy, regardless of side effect profile, is the only way or only sustainable way to prevent either severe infection or transmission and or obtaining actual coronavirus.
Right. So that takes us back to the question about whether the vaccine works and what it's intended to do. Because one of the controversial things is that people are saying, oh, if I can still get COVID if I'm vaccinated, what's the point? And you're pointing out that the vaccination keeps you out of hospital, and there's no question about that. Your likelihood of having a severe infection, your likelihood of being hospitalized is greatly reduced if you are vaccinated.
Likelihood of death, and that's a big thing, right? So your likelihood of dying from this is much significantly
right
low.
So that's that's part of the equation in the risk benefit. And people are wondering whether having lupus itself creates a risk for the vaccine. And I'm going to go a little further than you in terms of questions. It's safe for a person with lupus, and say yes, because it seems to be just as safe as it is in the general population. So most people, the vaccine is considered very safe, as a matter of fact. However, side effects, some side effects are fairly common. Like we're seeing like 10% of people having side effects, right? A little more than 10% having some side effects of the vaccine. But does the side effect, mean that your life is at risk? Not necessarily. Mm-hmm. So any comments on that? I mean, we're seeing the data that we're seeing is showing people having symptoms of common things. Injection site reactions, probably the most common one, right? And then we have muscle pain, joint pain, fever, malaise.
That vaccination syndrome.
Post-vaccination syndrome.
Right.
So people with lupus do get that too, right?
I mean, I think again, yeah. And I mean, again, I think the important thing is recognizing that we're in the middle, especially of a pandemic, and we're in the middle of a big surge of cases in Jamaica. And certainly the side effects compared to the effects of coronavirus itself is significantly higher. And especially with the Delta variant, because a lot of my patients will tell me, oh, well, I'll be super cautious. But the Delta variant is much more contagious than regular viruses. And
right.
So, your chances of getting infected and getting very sick, especially if you're unvaccinated. I'm going to say that the majority of the patients in hospital, I can count on one hand how many people are vaccinated that are admitted to the hospital.
All right. So as we're running out of time, so we're almost out of time, and we just want to touch quickly on some questions regarding, does the brand, there are actually 4 questions asking the same issue. Does the brand make a difference? Now we have 3 different brands in the market in Jamaica. Is the Pfizer vaccine preferred? You know, should you take a vaccine if you have had a pulmonary embolism? And what happens if well, those are the main questions that sort of tie in together there. So tell us about the different brands and what do we know in terms of efficacy and safety in general and for people who have lupus.
I think in terms of the differences in what's available to us locally, there's not much difference in terms of side effect profile. I mean, certainly the Pfizer has been associated with inflammation of the heart muscle in very, very rare conditions. And, you know, conservatively, the AstraZeneca has been associated with clotting, but remember that these effects are very, very small amounts of people who have actually gotten this compared to the millions who have been vaccinated. So I think that the most important thing is actually just getting a vaccine, right? At this point, especially when we're in the middle of a very high surge, the most important,
Right.
most important is being vaccinated.
Good. And I think if I can just jump in here, that they've actually looked at you know, the data may emerge as the numbers increase in our registries. What we do see is that on the question of clotting, because that's a big concern that people have, studies that are coming out recently, including one that just came out a couple of weeks ago, are not really showing that traditional risk factors for clotting can predict who gets a thrombus. So these clots are very rare. So you're talking about 4 in a million people. It's not usually the sort of thing that we, you know, not the kind of frequency that would make people worry about. But we also know that the fact that you have had a clotting history was not one of the factors that determined if you would have one of these rare clots. We also know, on the other hand, that COVID-19 is predictably causes clotting. So COVID-19 causes so much clotting that you have to anticoagulate people, right?
So, I mean, I would say to the person with pulmonary embolism is that you are far more likely to get a recurrent pulmonary embolism if you get the actual coronavirus. Up to a quarter patients, so 1 in 4 patients who have coronavirus will have a clot. So my advice for you would be, yes, you need to definitely get vaccinated, because if you get coronavirus, it's very likely that you get a recurrent clot.
Okay, great. And we're actually running, but we have 2 more questions that they're actually combined questions, because the next set of questions had to do with the medications and what should be done with medications when you're going to take the vaccine. And the questions relate to some persons on hydroxychloroquine, some persons on prednisone. Another person mentioned that she's on mycophenolate. And so people want to know what to do. And here's the other person who is on all 3. And then all those people, 5 people, want to know, can they take the COVID-19 vaccine when they're taking these medications? And is there anything they should change?
The answers are empathetic. Yes, you should. You be able to take the vaccine. I must say that some drugs like methotrexate and MMF reduce the efficacy of the vaccine, but it may not really truly be efficacious because we don't have much data on like long-term effects. But certainly, you know, beyond immunosuppression, people are less likely to respond as well to the vaccine. They won't get a good response. They may not get the best response. But in my opinion, the benefit of vaccination, even if you're on immunosuppression, is way better than not being vaccinated. So I think.
So basically, it sounds like the answer is yes. You can perfectly go ahead and take your vaccination regardless of the medication that you are on. It's good to know that especially 2 medications, one was methotrexate and one was mycophenolate, you actually may make less antibodies after vaccination than if you weren't on them. But at the same time, it's not a major deal breaker. So it's not a safety issue that should stop you from being vaccinated. If you get to talk to your doctor, he may give you permission to skip a dose of methotrexate or to skip a week of mycophenolate if you are well controlled. It's not really recommended that you stop any of them if your lupus is not particularly well controlled. So that's really the recommendation as it is now. So that would be my contribution to that. So we have one more question, if we are allowed, and this is about, and we can touch base on the next episode about this as well, but can a 12-year-old take the vaccine? Is it safe? And if so, which vaccine is recommended? Another question, same thing. Which one is recommended for children?
The only one that's FDA approved for 12 and up is the Pfizer vaccine. And certainly I would strongly recommend any child who is 12 and over to take the Pfizer vaccine because we're actually seeing an uptick in cases in children. And so, you know, it's really important to vaccinate your kids over 12 and up.
With the Pfizer. Okay, wow, thank you so much. We actually got through all our questions, went a few minutes over. So that was really good. Really want to thank you, Dr. Fisher, for taking time out. You're at the hospital right now. Yes. So we're just really grateful that you could just squeeze in some time to be live with us and answer questions. So this recording will remain on our YouTube pages and our Facebook page. If you missed it, if you were in traffic, you can still, you know, kind of join in and watch and, you know, post some comments in the chat that we'll look out for from time to time. So thank you so much for joining us. We want to remind you that October is Lupus Awareness Month, and we're actually going to be having an emphasis on children and youth with lupus, and that's going to pervade our emphasis for the whole month. Most of us experience lupus at a young age, and we have to carry it forward. So this is a really important area for us to emphasize. So we'll look out for us, monitor your our social media pages, monitor your emails, monitor your website for more information. We're going to have a launch on October 1. We're going to have a church service October 3. We're going to have a special edition of Ask the Expert Live for youth. And we're going to have our support group meeting. We have Laps for Lupus Awareness coming up on October 18. Most people look after, that's a really fun family event. And we're going to have our symposium on October 31. So lots going on. Join in, help us spread the word. You can help us with our social media campaign and get the word out. Knowledge about lupus really does save lives. And let's just join together to fight lupus.
Right, wonderful message.
Hi, Dr. Ananuju.